Today class, from the previous video, we have introduced the concept of holism. From the study, we understood that in future, when we see patients, when we see a specific disease, we need to consider the patient's condition, the environment, the geography, where does the patient live, the social status of the patient. So we need to take all these aspects into consideration. And in this video, we are going to introduce another key characteristics of the basic theory. The syndrome differentiation and treatment variation. This was a thought that's from the classic 伤寒杂病论. Dr. Zhang Zongjing, he proposed that in our treatments, we need to focus on the syndrome and the treatments should base on the syndrome. So from this statement, we understand that in future, in your practice, when you see patients, you need to identify the syndrome instead of the symptoms only, and the treatments, which points, which acupuncture points, which treatment techniques you're going to use will be based on the syndrome but not the symptoms. So let's see what's the definition of syndrome differentiation. Syndrome differentiation and treatment variation is a thinking. So this is a way of thinking, how you identify, how you understand the disease and the practical process. You're going to think in this way. You're going to implement your practice in this way. So a thinking and practical process. What's useful to identify the relevant syndromes of diseases, analyzing its therapeutic principles, method, prescriptions, and materia medica. How to do this? You need to apply the Chinese medicine theory. So what's most important? You need to identify something. You need to analyze according to the theory. You need to apply the theory in this whole process. The therapeutic principles. In future, we will study what are therapeutic principles. These principles are based on the syndrome. For example, a patient suffers from a heat syndrome or a cold syndrome. The principle will be relieving the heat or relieving the cold. So that's your principle. And then you use specific method, either herbal medicine or acupuncture, or even masturbation or cupping. That's your method. Your prescriptions. These prescriptions including the herbal medicine and acupuncture points. So for our programs, we will focus on prescriptions from acupuncture. So we're going to focus on the prescriptions with acupuncture. So from this point of view, you will see that although we study the acupuncture, we study the treatments with acupuncture, we still need to study the basic theory, because your treatments, your prescription will based on the syndrome, based on the theory. In order to understand the syndrome differentiation and treatment variation, we're going to separate them into two aspects. Firstly, the syndrome differentiation. The first question is, what's a syndrome? Diseases, symptoms or signs, and syndromes. Firstly, we will need to clarify the differences among these terms. The disease refers to the full phenomenon of the onset, the development, the recovery, or prognosis of a disease. So from the beginning to the end, when we talk about a disease, we talk about the causes, the principles, the characteristics of this disease. example, when we talk about hypertension or pneumonia, when we talk about hypertension, what are the possible causes? What are the contributing factors of hypertension? How does hypertension develop? And in the end, what are the complications? What are the patient's prognosis of this hypertension? Or another example, a more common example of flu or common cold. What are the pathogens? The first few days, after a few days, what are the patient's symptoms? And then during the recovery stage, what will happen? And normally how long? And these are all the information that we need when we talk about the disease. So from this point of view, when we talk about the disease, we actually mention the characteristic of the disease in terms of the common symptoms or signs, as well as the key diagnostic points and differentiation points. For example, when we talk about pneumonia, a patient may have fever symptom. The patient may feel headache. The fever can be the symptoms and also can be a sign. The patient may experiencing with a headache and cough. So all these are the characteristics of this disease. And then when we talk about the symptoms or signs, the symptom refers to the discomfort that the patient can experience. The patient will tell you the discomfort. For example, headache, stomach ache. Stomach ache can be symptom and also can be a disease name. Headache, runny nose, cough. So these are all the symptoms, and the signs are the information that the doctor gathers. For example, the cough can be a symptom and also can be a sign. The red tongue, or the enlargement of the lungs. These are all the signs from the examination from the doctors. So that's the differences between symptom and signs. Sometimes these can be one symptom can be both symptom and signs. One is the patient can experience, the patient will tell you what are the symptoms, what are the discomforts, and the signs is from the doctors. When we examine the patient, we will see something abnormal. The abnormal is called the signs. And then we talk about symptoms. The symptoms is a group of symptoms or signs at specific stage. What does it mean here is, for example, when we talk about disease, we mention that the disease is the full process from the beginning to the end. And in Chinese medicine, when we talk about the diseases, no matter what kinds of diseases, we talk about the pathogens. We talk about the healthy qi. In future, you will understand what's the healthy qi. Or at this stage, you can think about your immune system when you fight with the pathogens. So from the beginning to the end, and then we also mentioned that the symptom and signs in different stage. From the beginning, for example, for a flu, someone suffer from flu. From the first few days, the patient may feel headache, may experience runny nose, fatigue, and then after a few days, the patient may develop into fever, high-grade fever, and then with the treatments and poor appetite, and with the treatments, and then the patient recovers. So as you can see, when we talk about diseases, we actually include the common symptoms and signs in different stage. And then when we talk about syndromes, Now, we don't talk about the whole process from the beginning to the end. We're going to see from this session. The first few days, for example, a patient suffers from pneumonia. The first few days, what happens? In the next few days, what happens? We're going to only focus on here. And then when in the recovery stage, what will happen? So these are the signs. These are the symptoms. The symptoms. How do we know the syndrome? It's still based on the symptom and signs. The reason why we need to clarify these terms is because when we talk about a symptom and signs, a symptom made from different syndromes. A patient suffers from headache. A patient may suffer from headache from the pneumonia. A patient also can suffer from headache from hypertension. A symptom. So the symptom won't help you to identify the disease. The same symptom came from different diseases. The same disease may have different symptoms. That's why our treatments will be based on syndromes. During the full process of a disease, the development, we're going to focus on specific stage. The first few days, what's going to happen? And here, how do we know the syndromes? We're going to know the syndrome from the symptoms, from a group of symptoms. We're going to identify what's in common. And then, for example, the patient suffers from headache. A patient suffers from you identify a red tongue, a yellow coating. When you put all these symptoms and signs together, you will conclude to a syndrome. This patient may suffer from wind cold, may suffer from wind heat or wind cold, depends on the symptoms and signs. So now from the clarification, you will understand that a disease refers to the whole process. The symptoms and signs refers to the specific symptoms and signs, and then the syndromes refers to a group of symptoms and signs in specific stage of the disease. The syndromes, group of diseases, a group of symptoms and signs. From this point of view, you will see that different diseases they may have different syndromes. They also may have the same syndromes. So in the later slides, we will discuss how to treat the diseases based on the syndromes. And also, that's the reason why in our treatments, sometimes we use the same treatments for very different diseases. For example, we might use the same treatments for patients suffer from excess bleeding in the vagina and stomachache or diarrhea. We also may use different treatments for the same diseases. For example, two patients came to us with flu or stomachache or even hypertension. We might use very different treatment from herbal medicine or acupuncture points with the same disease. The reason is because the patients may suffer from different syndromes. So here, very importantly, we need to understand what are the differences among diseases, symptoms and signs, and syndromes. The syndrome differentiation is the thinking and the practice to establish the syndromes. So we talk about the syndromes, how to conclude the syndromes. We need to use the syndrome differentiation technique to identify the specific syndrome in order to understand the disease. Which means in this process, firstly, we need to gather the information, the clinical information for our 4 diagnostic methods, including observation, inquiry, listening and smelling, and palpation. Once the clinical data has been collected, you're going to use the theory to analyze the causes, the possible causes, the nature of the disease, the location of the disease, as well as the development trend of the diseases. And then we summarize and conclude to specific nature of the syndrome. So from this definition, when you see from the process, you will understand that we focus on the causes, the nature, the location, and the development of the disease. How to do so? We need to gather the symptoms and signs. For example, this patient suffers from headache. I didn't ask her, how do we know she suffers from headache? Or how do we know she might suffer from headache? That's from the observation. You see her expression. You see she's using her hands to hold the head, so this patient might suffer from headache. And then you may ask the patient to inquire the patient to confirm. That's from the inquiry. When you see the tongue, when you see these tongues, this one's quite red, this one's quite pale when you compare these two. You also can see the coating. This one is no coating on top, there's nothing on top of the tongue. This one, a thick coating on top of the tongue. Here, a white coating, less coating. So what do these signs mean to us? When you see a patient with a headache, and then combined with the pale tongue, or a patient with headache combined with a red tongue, these, when you use the theory to analyze, you will conclude to different syndromes. So that's the syndrome differentiation. From this point of view, you will see that the patient suffers from headache. However, if the different patients present with different tongue, or tongue color, or the coating of the tongue, or the patients present with different pulse conditions, then we may conclude to different syndromes. That's how to differentiate the syndrome. And then our treatments will be based on from this syndrome. In this process, we need to focus on the causes of diseases, the location of the diseases, the nature of the diseases, as well as the development trend of the diseases. For example, a patient comes to you with headache, fever, aversion to cold, body ache. From this group of symptoms, you might conclude that the patient may suffer from wind cold. And then the wind cold is the cause of this disease. And then the patient have a headache, the patient may have cough, and then you can differentiate the location of the diseases, might from either from the lung or superficial skin, or even in the head. So it depends on individuals. So from the symptoms and signs, we need to identify the nature of the disease. When we talk about the nature of the disease, we talk about the cold property, or the hot nature, the deficiency or the excess nature of the disease. These will include the differentiation, as well as the consideration of the body constitution and the development trend of the disease. For example, now we are during the pandemic of COVID-19, and then when you see a patient with COVID-19, when you see a patient with the tongue like pale tongue with some white coating, or a pale tongue kind of fat, you can see the teeth mark here on the sides is not smooth. And then you can conclude to one syndrome, this patient may suffer from spleen deficiency. And then when you identify the syndrome, you need to identify the development change of the diseases. A patient suffering from COVID-19 presents with this term, and a patient suffering from COVID-19 presents with this term. What are the differences between these two patients, and what are the development change of these diseases? These are something we need to think about. The reason is, for example, a patient presents with COVID-19, and then when you see the term like these, especially like this, then you may have the treatments, and then the patient may recover in a few days. However, if the patient presents with this kind of term, you shouldn't encourage that the patient going to recover in a few days. The patient suffer from this term, the development chance will be much long. The development of the diseases will be much longer compared with the rest of the time. So these conclusions are all from the syndrome differentiation. When you see different signs, when you see different diseases, at least you need to think about these 4 categories. What are the causes? Where is the diseases? What's the nature of this disease? What will happen in a few days? A patient suffers from wind cold, suffer from flu with wind cold or wind heat. They may have runny nose for the first few days, and then it may develop into cough, or cough with phlegm, or yellow phlegm, or white phlegm. These are all the development change of diseases. So when you see a patient, you need to think about these aspects. Once you have successfully identified the symptoms, you will go to the next stage of the treatment. The treatment will be based on the symptoms. You might use different treatments for the same diseases according to the symptoms. According to the different symptoms, that's why we say treatment variation. So it is a thinking and practical process of establishing the treatment principles and the treatment methods, and then selecting appropriate treatment methods. So from this point of view, you will see the treatment variation. Firstly, you need to identify the principles and methods, and then you're going to apply into practice according to the syndrome, according to different syndromes. There are 3 key aspects from treatment variation. The treatment principles are concluded from the syndromes. The formula, this formula can be the herbal medicine formula or the prescription of acupuncture points. The formula or the prescription is selected according to the principle. The treatment is based on the formula for the formulae. So when we see a patient, the symptoms and signs, that's something you can gather, and then from these symptoms and signs, you can conclude to a syndrome. From the syndrome, you can conclude to the treatment principles, and then you can choose the formula and apply into practice. So this is a full process when seeing a patient. For example, previously we talked about the headache or the common flu due to wind cold. So the wind cold is the syndrome. The treatment principle with the wind cold, we're going to focus on dispelling or dispersing the wind and relieving the cold. So that these are the principles. And then for this principle, we can choose different formulas, and then we apply to the patient. So that's the treatment variation. We're going to use a few examples to talk about specific conditions. In order to make it easier for you to understand how to apply the syndrome differentiation and treatment variation into practice, as well as what do we mean by all those definitions, we're going to present a few cases. We're going to discuss from the cases. Firstly, treating the same disease with different formulae. So because our treatment is based on the syndrome, when we use different formulae, you might think about this. This patient may have different syndromes. For example, the first patient, the patient have runny nose, sneezing for 2 days, sore throat, red tongue with thin yellow coating, floating pulse. So all these tones, some of these, for example, the floating pulse, you might not understand what that means. In future, you will learn all of these. And from this group of symptoms and signs, we can diagnose that the patient suffers from flu due to wind heat. That's because the patient presents with a thin yellow coating and floating pulse. So that's from the wind heat. And then the treatment principles will be dispel the wind heat. We choose the formula 银翘散. This is a herbal medicine formula, and then we apply into the practice. For acupuncture, we also can choose different acupuncture points for this purpose to dispel the wind heat. So after the second year, after you study the acupoints and meridians, you will know you also can use different points for the purpose of releasing the wind heat. Second patient. This patient also suffered from runny nose, sneezing for 2 days, but this patient presented with fatigue, coughing, pale tongue, with thin white coating, floating and tense pulse. The diagnosis of this patient also suffered from flu. However, due to wind cold, this is the syndrome. Another treatment principles will be dispelling the wind cold. We use Ma Huang Tang. This is another formula. So in acupuncture practice, we also can use another group of points for wind cold. Then we apply into practice. As you can see from these two patients, patient 1 and patient 2, both of them suffer from flu. However, because they have different symptoms, the wind heat and wind cold, we use different formula. The ingredients of these two formulas are very different. And then, how do we know the symptom? This means the patient presents with the same symptoms of runny nose and sneezing. However, they got different signs: thin yellow coating and thin white coating, as well as the sore throat and fatigue. So from this group of symptoms, we can conclude to wind heat. On another group of symptoms, we can conclude to wind cold. So from here, we will understand, although these two patients suffer from flu, the same diseases, because they have different syndromes, we will use different treatments. In the other situation, treating different diseases with the same formula. A patient suffers from stomachache, poor appetite, diarrhea, pale tongue with thin white coating, and then the diagnosis of this patient is diarrhea due to spleen deficiency. That's from the symptoms. From the symptoms and signs, especially the pale tongue and thin white coating. And then the treatment principles will be tonifying the spleen. The formula we choose 补中益气汤. This is also a herbal medicine formula to tonify the spleen, and then we apply into practice. In another situation, another patient came to you with bleeding, excess bleeding, female, excess bleeding, or 3 weeks, fatigue, low abdominal pain, pale tongue with thin white coating. The diagnosis, irregular menstruation. The symptoms, because of this group of symptoms, we can identify the patient due to spleen deficiency. The treatment principles will be tonified spleen. We still use 补中益气汤. From these 2 cases, you will see that we use the same formula, 补中益气汤, which can tonify the spleen. However, we use on different diseases, very different diseases of diarrhea and irregular menstruation. The reason we choose to do so is because these 2 patients suffer from the same syndrome, spleen deficiency. Although they have very different symptoms and signs. The formula, as we said, that you can use acupuncture points, for example, the 1, 中脘, and some other points to tonify the spleen, stomach 36, to mention some as an example. What's important in this whole process is the treatment principles. Why you can use the same formula to treat very different diseases? The reason is because this patient have the same treatment principle. These principles is from the syndromes, because they have the same syndromes. That's what do we mean by syndrome differentiation and treatment variation. You can use the same formula for different diseases if the patient presents with the same syndrome. You may use different formula. You may use very different acupuncture points to treat diseases if the patient presents with different syndromes, even if they suffer from the same disease. So as you can see from these 4 patients, from these examples, our treatments, we will base on the syndrome. The treatment is based on the syndrome. So this is very different from the other medical system. For example, from conventional medicine. For hypertension, they will use tablets to reduce or to control the blood pressure. No matter which patient, they will choose different tablets according to their symptoms, but that symptoms is not from the syndrome, but from their complications, from the side effects, from these points of view. They will use very similar or even mostly can be the same tablets for the same diseases. This will not happen in Chinese medicine, or more precisely, it's not common that's in Chinese medicine. We will base on the syndrome. Apart from the syndrome differentiation and treatment variation that we have mentioned in the previous slides, there's another approach, disease differentiation, that also can be used in our diagnosis, although this is not very common. For example, a patient suffers from malaria. We may use Qinghao, sweetwood wood, to treat the malaria. A patient suffers from ulcerative colitis. We can use a formula, 带黄牡丹汤, to treat this disease. A patient suffers from frozen shoulder. We got inflammation in the shoulder. We can use stomach 38 on your leg to treat the shoulder problem. So these are specific points or specific herbs, specific formulas for specific diseases. It's called disease differentiation. So now you will understand that For our differentiation, we differentiate the syndromes. We also differentiate the diseases. So in our treatments, we might combine both of them. In this video, we mainly focus on the syndrome differentiation and treatment variation. We almost go to the end of the general introduction of the basic theory. From the next video, we are going to talk about the detailed information of the theory. In this topic of the basic theory, we are going to focus on the philosophy, the physiology, as well as the diseases, the prevention and the treatment of diseases in terms of Chinese medicine. The Chinese medicine and acupuncture, we use the philosophy to understand the nature, to understand the environment, as well as our human health. We are based on the anatomy. However, we also use the philosophy to explain the physiology of our human health, of our human activities. So all these aspects are the information we need to focus on we need to study and we need to focus on in the basic theory. Thank you for your attention.